Hi, my name's Matt Venus. I'm a consultant plastic surgeon with an interest in hand surgery. So carpal tunnel is a condition whereby one of the main nerves to the hand stops working properly. The nerve crosses from the forearm into the hand via a tunnel called the carpal tunnel, which has got bones and a tight ligament around it. Sometimes, for reasons we don't always understand, the nerve gets squashed in the tunnel and produces symptoms such as pins and needles, numbness, or even pain. Carpal tunnel is a condition that can affect people of any age, but mostly happens for people in their 30s to 60s. You do see carpal tunnel very rarely in children and in older people. So for the most part, carpal tunnel syndrome is what we call idiopathic. It happens for reasons that we can't explain. There are some known causes of carpal tunnel, for example a cyst or a ganglion that presses on the nerve, but that would be quite unusual. There's no evidence that carpal tunnel syndrome is related to work or keyboard use, but sometimes activities such as these can make the symptoms worse. Patients most commonly complain of pins and needles or numbness in the hand, particularly affecting the thumb, index or middle fingers. If carpal tunnel syndrome persists for some time, then the numbness can become permanent and some patients even get weakness, particularly in the thumb muscles. Most patients complain of clumsiness when this happens, and this usually indicates quite severe carpal tunnel syndrome. When I see someone who has carpal tunnel syndrome, try to think about the condition as either being mild, moderate or severe, because that helps us start to decide how best it should be treated. Mild carpal tunnel syndrome is usually when the symptoms are intermittent and consist of mainly pins and needles. In this case, the carpal tunnel syndrome is usually treated with a splint or sometimes a steroid injection. For moderate carpal tunnel syndrome, where the pins and needles are more continuous or the patient even has numbness, then a steroid injection is the usual first line of treatment. For patients who have severe carpal tunnel syndrome or in whom splints and steroid injections have not worked well or the symptoms have recurred, then surgery is usually indicated. Surgery is traditionally performed by making a long incision in the palm of the hand that crosses into the forearm to completely release the ligament that's causing the carpal tunnel syndrome. I also offer an endoscopic method where the incision is made only in the forearm, and this means that we can operate on both hands at once and the time to recovery is much shorter. So if you come to have your carpal tunnel released surgically, the procedure is done as a day case and is done under local anaesthetic. I'll place an injection of local anaesthetic around the base of the hand and into the palm of the hand to provide complete comfort and numbness for the surgery. After sterilising the skin with antiseptic, I will inflate a tourniquet in the upper arm to stop any blood flowing down into the area for surgery. Make a small incision, transversely, that means across, at the level of the wrist, and introduce an endoscope so I can clearly see the ligament that's causing the carpal tunnel syndrome. Then we divide the ligament from the inside of the hand and sew up the wound using dissolving stitches. The tourniquet is a little uncomfortable, but is usually applied for less than 10 minutes for the surgery. After the surgery, you wear a bulky bandage for a couple of days, which can then be taken off at home, and a simple plast is required just to cover the wound for the first week. Most patients find that they can get back to their normal activities by the end of the first week, although some patients can take up to 2 weeks to recover completely. Most patients recover very well from the operation and have a normally functioning hand within a couple of weeks. I usually like to see my patients 6 to 8 weeks after the surgery to be sure everything's settling down. If there is any stiffness or pain, then this can be addressed with hand therapy, although it's not usually required.